Hi, my name is Dr. Sharon Bryant, and I am one of the acute care nurse practitioner faculty here at Vanderbilt University School of Nursing. I'm here today with my colleague, Dr. Catherine McNabb, and together we are going to discuss the AGACNP Hospitalist Subspecialty Focus. The Hospitalist Subspecialty Focus is intended for those students who wish to have a career in hospital medicine. As we go through this presentation, we will present to you both the didactic and clinical components of this subspecialty focus. Students must first be admitted to the AGACNP program. All students will take core program curriculum requirements as indicated in the AGACNP home website. Students have the option of specializing in one of three tracks: the intensivist track, the hospitalist track, or you can stay in what we call the traditional track. The hospitalist track, which is what we will focus on today, starts in the spring semester. So how do you get to the hospitalist track? Well, first, all students must be admitted to the AGACNP program. All AGACNP students, regardless of what track you choose, will take core AGACNP program curriculum courses. In the fall, you will have an option to specify which track of interest you so choose. When choosing the hospitalist track, we will have a list of questions that we will ask you to complete, as well as a history of your past clinical experience. The hospitalist track is friendly to both distance and local students, as it does not require you to be on campus other than for block sessions in the spring and summer.
Hi, my name is Dr. Catherine McNabb, and I am one of Dr. Bryant's colleagues, and I help co-coordinate the hospitalist subspecialty within the AGACNP program. So some students ask Dr. Bryant and I, well, as a hospitalist, where can I practice? And really and truly, the practice setting for hospitalists comes in any subset within hospital-based medicine. So traditionally, students will consider general internal medicine practices, but really this term is broad reaching in that you can be a general medicine internist, but you could also practice in subspecialist teams. So for example, on the hematology or oncology hospitalist team, or an infectious disease subspecialty. So your opportunities are really endless when choosing the hospitalist subspecialist, as you can cross the entire trajectory of hospital-based medicine. So what does the hospitalist focused educational content comprise of? So we teach you specific didactic content that is focused on the Society of Hospital Medicine's core competencies, which focuses on interpersonal skills and communication amongst teams, obviously medical knowledge, but also systems-based practice, practice-based learning and improvement, as well as patient care initiatives. So we give you didactic content that is focused on hospitalist-related care. We also take you into our high-fidelity simulation lab and expose you to a variety of learning modalities. So caring for the patient that comes in with acute seizures, or caring for the patient that has a acute electrolyte abnormality and you need to triage and manage that patient. Giving you relevant patient clinical experiences that will prepare you well for advanced practice and entering the workforce as an acute care hospitalist. And then finally, when we talk about advanced procedural labs, we build upon the content that you received in the fall in terms of training on procedures and expose you to shave biopsies, punch biopsies, as well as incision and drainage procedures. So refining and enhancing your skills from a procedural standpoint. Now, what would you be doing from a clinical experiences standpoint? Generally speaking, we try and have students have 1 semester of a general hospital practice. So working in internal medicine on the floor, as well as in sometimes subacute intensive care unit environments. And then if you have a subspecialty area of focus that has interest for you, we try and pair you where your interests align. So for example, if you have interest in nephrology, we then want to pair you with an AGACNP colleague that specializes in nephrology. Or if you have interest in neurology patient population, we want to give you that additional training. So 1 semester of general hospital practice and then 1 semester of a subspecialty focus.
Next, we'll discuss the full-time and part-time plans of study for the AGACNP Hospitalist. Full-time plan of study is listed on this slide, and you will see that you take the same coursework as the traditional students in the fall. In the spring, all full-time hospitalist students will enroll in Nursing 6148, the didactic course for the hospitalist focus, as well as 6165, the lab component of the hospitalist focus. Nursing 6148 is taught online with live lectures delivered virtually each week in a web-based platform. Students will hear a lecture on that week's topic. Nursing 6165 is taught in correlation with the AGACNP block weeks, which are listed on the AGACNP website. The purpose of this is to limit the amount of travel frequency for all off-campus distance students. During this time, you'll participate in hospitalist-focused high-fidelity simulations, as Dr. McNabb explained on the previous slide, as well as advanced procedural lab training. In regards to your clinical courses, all hospitalist students remain integrated with the traditional students, thus taking 6115 and 6195 as their clinical courses. This allows for integration with the traditionalist students for extra high-fidelity simulation training. Students who are in Nursing 6115 and 6195 are each assigned to a clinical course faculty member. For those students who are in the hospitalist focus, they will be assigned to either Dr. McNabb or myself for the duration of their clinical experience. The purpose of this is to further discuss hospitalist-related issues as they come up in conference on a weekly basis. For those students who are part-time, you can see that the courses slightly change. On this slide, you will see that your hospitalist coursework is split. The reason for this is to keep all clinical content within the same year. In the first year of your study, you will take Nursing 6148 in the spring, which is the didactic portion of this focus area. In the spring of your second year, you will take Nursing 6165, which is the clinical course related to the hospitalist focus area.
So how does a student apply to the hospitalist focus? All hospitalist students must first be accepted into the AGACNP program. During the fall semester of the program, students will be offered an opportunity to hear more about the hospitalist subspecialty program. Students that are interested in hospital medicine may then apply to the focus group by completing a written interview questionnaire with a goal statement. The purpose of this is to ensure that the hospitalist focus area is appropriate for your future career goals. The focus group is not capped at a certain number of students due to the wide range of available clinical placements.
This concludes our presentation on the hospitalist subspecialty. If you have any additional questions about the hospitalist subspecialty focus, please feel free to reach out to either Dr. McNabb or myself. Have a great day.